glad you came in today. I've got to ask you some questions. We're going to do an assessment real quick and just give me some information, just some general information, and then there will be some questions that will be easy to answer. There may be some questions that may be a little difficult to answer. If there's any questions that you do not want to answer, I'll give you some time. You can tell me to skip that one. We can come back to it. If you don't want to answer it then, that's fine too. But all the information that you give me will help me be able to compile some data better, some information about just kind of where you are at this moment in your life. And we'll be able to assess that and kind of plan from here what it is we can do to, just help you be a better version of yourself. So I have that you're 19 years old. You prefer to be called Caitlin,
Yes.
is the nickname. You are single, though you are in a committed relationship.
Yes, ma'am.
And you're here today because you're having some issues with your anxiety. Is that correct?
Yes, ma'am.
If you could list on a scale of 1 to 10, with 1 being it's there, it's a little bothersome, and 10 being I'm finding it difficult to function, and this is all I think about, where would you kind of put that on a scale of 1 to 10?
A 7.
A 7. Is this issue that you come here today, is it causing you any issues with your sleep patterns? Like, are you sleeping more than normal or less than normal?
I do sleep a lot.
So sleeping more. What do you typically sleep? About how many hours a night? On a normal basis when you're not having some issues with your anxiety?
7 to 8.
And now, how much do you think that you're sleeping?
Like 10 to 11.
10 to 11? Are you having difficulty staying asleep? Are you waking up in the night? Or do you have difficulty staying awake during the day?
I will wake up during the night like 3 to 4 times.
As far as your concentration, do you feel like that it has decreased your ability to concentrate, or do you feel like it's increased and you're constantly concentrating on things?
I definitely can't multitask. That's the thing.
So decreased concentration, and specifically with like multitasking. Have you noticed a change in your appetite at all? Do you feel that you have an increased appetite or a decreased appetite?
Not really, no.
Kind of the same. So how have you noticed that your anxiety has increased? What are some of the things that you've noticed?
I'm a lot more aware of things. And my emotions are all over the place all the time.
You're going to have to speak a little bit louder. Have you noticed any mood swings?
Yes.
Okay. Would you say that those mood swings, do you find that it swings to sad, or you swing to irritable? What direction do you feel that you swing to when you're feeling anxious?
Probably irritable.
Irritable? Have you noticed any changes in your own behavior?
Not really.
I can give you some examples. So, do you find that you want to be around people, that you've chosen not to be around people more? Like, are you kind of staying at home more? Or are you still as social with your friends as you were?
I do find myself staying at home a lot more often.
Anything else that you've kind of noticed that you're doing a little differently than what you normally do?
I sit around a lot more than I used to and don't really do anything.
So these questions are going to get a little bit more difficult. If it's easier just to say yes, no, or skip that one, that's totally fine. So this part of the assessment just talks about victimization. Have you ever been the victim of physical abuse?
No.
Sexual abuse?
No.
I'm assuming not elder abuse, since have you ever witnessed elder abuse?
Yes.
Do you understand what elder abuse is?
Yes.
Okay. And you have witnessed it?
Yes.
Were you molested as a child, or do you know someone that was molested as a child?
I know someone who was.
Have you been the victim of a robbery or assault?
No.
Dating violence?
No.
What about dating violence in the form that's not physically aggressive but maybe verbally aggressive?
No.
Okay. Have you been the victim of domestic violence or witnessed, been in a house with domestic violence?
I've witnessed it.
Witnessed it? Was it friends or family, parents? Family. What about human trafficking? You've been a victim of human trafficking or lived in a home where something like that was going on?
No.
Have you been the victim or involved in a DUI crash?
No.
And are you a survivor of anyone who has been a homicide victim or that has been murdered?
No.
Or are you the family of anybody that you know that has been murdered? No? Okay. I know those are a little difficult. I thank you for your honesty. How long has this problem been causing you distress with your anxiety? Have you noticed it's been a week, a month to 3 months, more than 3 months?
Maybe a little more than 3 months.
Would you say 6 months to a year or less than a year? 6 months to a year? So do you understand what coping skills are, how we cope
Yes.
with anxiety or with issues that are abnormal that's going on in our life? So how would you rate your current level of being able to cope with your anxiety on that same scale of 1 to 10, with 1 being I'm barely able to cope, this is overwhelming, and 10 being I have very strong coping skills and I'm managing my anxiety well?
Maybe a 5 or 6.
5 or a 6. So you feel like you have some pretty average or effective coping skills. Is that a correct statement?
Yes.
Are you currently employed?
Yes.
And what do you do where you work?
I'm a pharmacy technician.
You're gonna have to speak just a little bit louder. How long have you been a pharmacy technician?
A few weeks.
A few weeks. Well, congratulations on your new job. Do you enjoy your new job?
I do.
What do you like the most about it?
I like the small, knit group of people that I've kind of become friends with.
So your coworkers?
Yes.
Oh, that's good. What would you say that you dislike the most about the job?
I haven't found anything yet, to be honest.
Nothing
with you.
yet?
No.
Well, that's a good thing. Nothing yet. Are you currently being seen by a counselor?
I am.
Do you have feel like you have a good relationship with them? How long have you been seeing your counselor?
A few years.
Few years? That's great. Are you currently being seen by a psychiatrist?
No, ma'am.
No. Have you been seen by a psychiatrist before?
Yes, ma'am.
In the past? As an adult or as a child or
As a child.
as a child? Did you have a diagnosis when you were a child? Do you recall the psychiatrist or the counselor ever giving you any type of diagnosis?
No, ma'am.
You don't recall? You didn't get a diagnosis or you don't recall?
Don't recall.
Don't recall. Have you ever gotten some type of diagnosis as an adult?
I have not. No, ma'am.
Okay. Have you ever been hospitalized for your anxiety or any other non-medical issues, like mental health related issues?
I have not.
No? The next series of questions are just about safety concerns for yourself. Do you have any thoughts of suicide or any thoughts of harm to yourself? Even if you wouldn't act on those thoughts, do you have thoughts about harming yourself? Or what it would be like not to live anymore? No. Have you ever attempted to commit suicide?
I have not.
Do you have a history of suicide or attempted suicides in your family?
Not that I'm aware of.
Not that you're aware of? Are you presently homicidal? Would you like to hurt someone else?
No.
I know it's a silly question, but you know, you would be surprised often the people that will have some transparency, even if they would never do it, just, you know, kind of the thoughts of it. And that transparency and honesty in this situation doesn't mean that I believe that you would. It just means that, you know, you're giving me information that'll kind of help me get a better picture where you are. If I will say in full transparency, if I thought that you were a harm to yourself or you were a harm to someone else, you know, then I would have to kind of reevaluate, and we have to, you know, take actions to make sure that nobody gets hurt. So telling the truth about that isn't a negative thing, and it wouldn't be held against you. It's just how can we look at this, you know, from an intervention standpoint and help. Do you have any information in regards to any safety concerns that anyone has had for you in the past? Or any safety concerns that you have had for yourself in the past?
No.
None? So I'm going to ask you about a series of diagnosis or mental health concerns, and sometimes about drug or substance abuse. So if you know yourself, your parents, or the other criteria is like your aunts, your uncles, or your grandparents. So it would be you, your mom and dad's brother and sisters, or your grandparents. So has anyone in your family had depression?
Yes.
Okay, who had depression?
My mother.
Your mother? Anyone else?
Not that I'm aware of.
Okay, what about anxiety? Has anyone else in your family had anxiety?
Yes. My mother and my sister.
Your mother and your sister? What about bipolar disorder?
Yes. My mother.
Anyone else besides your mother?
No.
No aunts, uncles, grandparents? Okay. What about schizophrenia?
My grandfather.
Would that be your mom's dad or your dad's dad?
My mom's dad.
So your maternal grandfather. Anyone else in your family had schizophrenia? What about ADD or ADHD?
My mother.
Your mother? Anyone else in the family?
I don't think so.
What about a history of trauma? And that could be trauma when they were a child or trauma when they were an adult. And, you know, trauma can include anything from some of the abuse that we talked about earlier to living in a domestic violence situation. So anyone in your family had a trauma history?
Yes.
Who would that be?
My mother, my father, my grandmother.
Your mom's mom or your dad's mom?
Both.
Okay, maternal grandmother and paternal grandmother. Who else?
My mother, my father, and then my sister.
And yourself.
Yes.
Has anyone in your family engaged in or have a history of abusive behavior? Could be physically abusive, mentally abusive.
My father, my mother, and probably my grandmother on my mother's side.
So your maternal grandmother.
Mm-hmm.
What about a history of alcohol abuse?
My father.
Anyone else?
No.
What about drug abuse?
My mother, my father, and then an uncle on my mother's side.
So your maternal uncle?
Yes.
I always remember those maternal, paternal, because maternal is mom and paternal is like pop. That's how I always remember those. Does anyone in your family have a history of incarceration?
Yes.
Okay. Who would those people be?
My mother, my father, my sister, my grandfather on my mother's side.
Okay.
Maternal and paternal, both of them.
Okay, maternal and paternal grandfather.
And then my uncle on my mother's side.
Maternal uncle. Okay. What about yourself? Have you ever been incarcerated?
No.
Okay. told me that you're single. Have you ever been divorced, married, or separated? No. And how do you identify yourself? Would you say heterosexual, homosexual, bisexual, questioning, fluid?
Heterosexual.
Is there anything that you think would be important for us to know about your significant relationships, any relationships you've had currently? And then we'll discuss in the past, but right now, is there significant relationships that, we'll say positive, significant relationships that you have right now with people in your life?
I have plenty of people that I can turn to now in life.
Are they family? Are they social? Who are the people that are positive, significant members?
Both. I have family members and friends that I can turn to.
Family and friends. Are you involved in anything in school or church that are also positive support systems for you?
Yeah. I'm on the cheer team.
A cheer team? That's nice. Let's think just a minute. Have you always had positive relationships, or do you feel like there was a period of time that your support lacked more than it does now?
For sure, but I think everybody goes through that at some point.
So do you feel like your relationships now are more positive than they have been for you?
I do.
Well, that's good. Let's talk about, just for a moment, can you identify any negative, significant relationships that have a negative impact on you currently?
None that I currently partake in.
So none that you currently partake in, does that mean that you have previously had negative relationships?
So,
Who was that with?
my sister.
Your sister?
Mm-hmm.
And how do you, you said you had previously had a negative relationship with her. What did you do that's not current for you right now?
We would argue a lot. We didn't really get along.
So how is that relationship not present for you right now in your present life? Do you see her or speak to her now?
No, ma'am.
We just
don't communicate.
You just don't communicate. Was that your choice?
It was.
Who do you currently live with?
My parents.
What does the household look like, the composition of your home? Who's all in your home right now?
I have both of my parents, and I have a little brother and a little sister.
What are their, so you have mom, you have dad, and you have a brother and a sister. How old is your mom?
41.
And how old is your dad?
44.
And how old's your brother?
He's 4.
4. And your sister?
He's 7.
4-year-old and a 7-year-old, but they keep you on your toes. Who else do you feel or do you believe that would be helpful or important for us to know or understand about your relationships with your family or your family members?
I'm not sure.
Do you have any other meaningful relationships right now that you can identify besides your immediate family? And you said you have a close group of friends. Is there anybody else that you feel that you can trust and you can talk to? Of course, your counselor. You've been seeing your counselor for several years, you said. Anyone else?
No, ma'am.
Okay. So now we're going to talk about any recent losses that you may have experienced. Again, you can say yes, no, skip over that question. We can revisit just whatever you're comfortable with right now. Have you, and this isn't just currently, this is in the past, just kind of leading up, have you experienced any significant losses of a family member?
No.
Friends?
No.
Any recent loss or impact on your health? your lifestyle. If you had a significant lifestyle change, it would be a loss for you.
No.
Job or income. Have you suffered any significant loss of housing?
No.
Okay. So right now, do you consider your housing to be stable or unstable?
Stable.
And you currently own, rent, live with relatives, is that correct? And you live with them permanently, or is this just a temporary situation?
Permanently.
Well, I mean, you're 19 years old. You're getting to the age where you're in college. I don't mean to put the spotlight on that, like what's going to happen right now. It's more like we all know that as you get older and you get in college, you'll eventually transition on your own. What this question is saying is are you living with relatives on a temporary basis, like you have a couple weeks, or you don't know how long you can stay there, or is it permanent, as in you can stay there until you choose to leave?
Yes.
So, okay. How long have you lived in your current living situation?
4 years.
And have you experienced a move in the past 2 years? Like moved homes, not necessarily people, but building structures? Is there anything else that you would think would be important for us to know about your housing or living situation, or the history of your housing or living situation?
No.
No? Okay. These next questions are going to maybe a little bit difficult, and again, you can say yes, no. You can choose to discuss it more or elaborate, or you can just say skip it and we'll keep going.
Okay.
Have you ever been in foster care?
No.
How would you describe your overall health?
Good.
Do you experience any, do you have any health issues or experience any reoccurring? It doesn't have to be anything significant medical. For instance, I have chronic bronchitis that I deal with a couple times a year, but it's easily treated. Do you have anything that you currently will pop up on you, or any more serious medical issues that you have?
No,
Okay.
I generally stay pretty healthy.
Do you have any reoccurring issues such as allergies or asthma? Allergies?
Yes.
Are they environmental, or is it to food, or
Seasonal.
Mm-hmm. Do you take any prescription medication for your seasonal allergies, or just
Over the counter.
over the counter? So I want to ask you about if you have had any medical problems or physical limitations now or in the past. Do you have any, have you had any medical issues in your past up until this point? You said you had none now, but you don't recall any as a child, any significant medical issues or anything like that you had to receive treatment for?
No.
Okay. What about sleep problems? I know that you told me you had some changes in your sleeping now, just kind of given your anxiety, but have you experienced sleep issues in the past?
Yeah.
Is it kind of the same thing? Can you identify if it was related to anxiety, or was it on its own even when you weren't experiencing anxiety, you had issues sleeping, or do you think it's only periods of time where you have had some anxiety?
It was probably anxiety related.
Did you know that then, or did you just think you couldn't sleep well?
I just thought I couldn't sleep.
What about a history of unusual eating habits? And that could be something that you've noticed, or something, sometimes our eating habits can change just based upon situations. It could, as females in particular, certain times of the month we can crave sweet stuff, or we crave salty things. So I'm talking about, have you noticed that there's times that you have consumed more, or you have abstained, that may be from different than just like, when women experience that in a month, during a certain time of the month?
No, I have noticed that when I'm super duper emotional, I tend to stress eat, kind of.
So, so when you're experiencing, so what I hear you saying is that when you're experiencing a lot of emotions that you do feel that you stress eat.
Yes.
What does stress eat look like for you? Would you say?
Lots of chocolate.
Lots of chocolate? I can feel that. I feel that too. I do the same. Have you had periods of time where you have, this states poor hygiene. I think a better explanation is not poor hygiene where you deliberately neglected yourself, but have you had periods of time where you just had difficulty taking a shower or brushing your teeth or just get up and doing normal routine things that you wouldn't think twice about? Has there any been time you've struggled just to find the energy or the willpower or anything just to do your normal habits? No? Okay. Your overall physical fitness, how would you classify your overall physical fitness?
It's okay.
I mean, you're a cheerleader, you said, right? Gotta have some degree. Have you had any prior head injuries?
I have not.
What about any infections early on in your childhood that you can recall? No?
I don't recall anything.
Have you had any type of eating disorders? Now, this isn't necessarily related to stress eating, but eating disorders as in you've abstained because you were conscious of your physical appearance, anything like that?
No.
Have you had any knee or back injuries?
I have not. No.
And this, ask about asthma, but you had just previously said no asthma, just seasonal allergies.
Mhm.
Okay. Do you currently take any medications?
I do not know.
Okay. And have you taken any medications in the past 6 months that are like psychotropic medication, over the counter, or herbal remedies?
No.
Nothing to help you sleep or
Some Tylenol PM or
Tylenol PM? How often do you think, how frequently do you think you take Tylenol PM? Let's say on a week basis. In 1 week, how many nights do you think you probably take it?
maybe once.
Maybe once.
Yeah.
Any other over-the-counter medication? What about multivitamins or
Melatonin.
melatonin?
Mm-hmm.
Do you take that at the same nights you take Tylenol PM or at different times?
No, I don't take it when I take Tylenol PM.
And if you, same question, in a weekly basis, how many times do you think that you take melatonin at night during 1 week?
Probably every night, minus when I'm taking Tylenol PM.
Every night except the Tylenol PM nights.
Yes.
Are you on, and you said you're not on any other type of prescription medication, not psychotropic drugs or any other type of, but I mean like any other prescriptions for anything, okay? Are you on any medication for your allergies right now?
No.
No, okay. Have you ever had a serious accident, illness, or hospitalization? An accident doesn't just have to be car accident. It could be workplace accident or accident within the home, or we live near a lake. Just any type of significant accident or illness that you've had to deal with in the past.
No.
Any hospitalizations?
Nope.
Who is your primary care doctor? You could just make it a name.
Dr. I.
Okay. Do you have a current history of any alcohol or drug use?
No.
Any past history?
No.
Do you ever drink socially?
Yes.
So socially, let's say in a month, how many times would you drink in a month socially?
I wouldn't even say it would be that often. So maybe once.
Maybe once a month socially. And when you drink that one time a month socially, do you drink more than you intend to, or do you drink what you expect to?
No, I don't drink much.
How many, let's say the one time a month socially that you drink, how many drinks do you think you have?
Maybe 2.
Maybe 2? You don't have a history, or do you have a history of overdosing on alcohol, drugs, or prescription medication or over-the-counter medication?
No.
And that can be whether intentional or not, like an accidental overdose on any type of medication.
No.
Have you ever experienced a blackout?
No.
So blackouts can be not necessarily alcohol or substance abuse induced, just sometimes there's an emotional blackout where people get extremely stressed out or extremely angry, or in a situation that's very emotionally charged, you can black out as well. So when I say that, I don't necessarily mean substance abuse or alcohol or drugs. So have you ever had a blackout episode before? No? Do you have any type of history of seizures?
No.
And with whom do you typically consume your alcohol? Family, friends, strangers?
Family or friends.
Family or friends. Okay. So this question, the next little bit of questions, we're going to touch back on abuse and neglect a little bit, and then we're also going to talk about any legal issues. Do you have any pending legal issues?
No.
Do you have any past incarcerations or charges? Have you ever been on probation?
No.
No. So you have had no past involvement with law enforcement and no current involvement with law enforcement.
Right.
Okay. So have you ever been abused or assaulted?
No.
And this can be relatives, it can be friends, it could be strangers, any type of assault or abuse.
No.
Do you feel like there might be any reason that you might be in danger now? Is there any situation or person that you're fearful of, or feel that you may be in danger? Is there anything else that you feel that is important for us to know about some of the topics we just discussed? History of abuse, neglect, legal involvement, drinking or substance abuse?
No.
Do you have any concerns for yourself? Okay. Now, have you ever been accused of abusing or assaulting someone, whether it be stranger, friend, family?
I have not. No.
So this is one of my favorite parts of this assessment, and we talk about challenges and issues and barriers, but then we also talk about your strengths and the resources that you have available to you that you can identify for right now. So if you had to list any limitations, in self-reflection that you may have, can you identify any limitations for yourself? None?
No.
Identify some of your strengths that you feel like you have. That's okay. We can work on that. We can identify some strengths that you have. What resources do you feel that, if you could identify some resources right now that you currently have in place to help you with your current problem, or what we call your presenting issue, which is your anxiety, can you identify any resources that you have right now to help you with that?
My counselor.
Your counselor? Anyone else?
No.
Okay. What experiences, it can either be now in your present or in your past, will help you in improving your current situation? Can you think of experiences that you have lived through in the past, or that you're currently going through now, that you think would be good tools, or you could use the experience to help you improve your situation?
Not sure.
You're not sure. Okay, that's fine. Your experience with your counselor and being open to counseling and, kind of the review process of yourself, that is a strength. The fact that you are honest and transparent and you're seeking professional help, that is definitely a strength that you can identify about yourself, that you're receptive to that. We can identify more of those as we go along, or if at some point you identify something that may be the assessment calls it a limitation, but you can call it a barrier or a challenge, something that is a challenge to your, to the situation that you have right now or strength. You can tell me and we can always go back to this and add it in. Sometimes those questions are a little difficult to reflect on yourself, like right there in that moment. So I want to give you the opportunity to revisit that if you want to.
Okay.
If you don't, that's fine. What are you and your family or your support system that you have listed doing to improve your current situation with your anxiety? Is your family assisting you, or this little group of friends that you had assisting you to improve your current situation, or are they aware that you're experiencing this?
Not really.
They're not aware? Or?
No.
So what could, if you could identify something that you're doing to improve your current situation, could you identify something?
I journal.
You journal?
I do.
Do you feel that helps you when you journal?
I do.
Who can you count on for your current support? So I'm gonna just call off some relationships, and then you identify just a yes or a no, or you can skip it, and I won't pry any further with that. So who can you count on for support? It has parents,
Yes.
boyfriend, girlfriend,
Yes.
siblings.
No?
Probably hard with a 4 and a 7-year-old.
Yeah.
Pastor.
Yes.
Do you have extended family that you can count on for support?
Yes.
Friends,
Yes.
neighbors.
Yes.
Is that a yes?
Yes.
Okay. School staff?
No.
No. Church?
Yes.
I know it listed pastors, but you have church members or groups within your church. Okay. Your therapist?
Yes.
Community services?
No.
Okay. And your doctor?
Yes.
Okay. Anyone else that you feel that you can count on for support?
I think that covers it.
It doesn't necessarily have to be related to your anxiety, just it can be as a person as a whole, anyone that you feel that you can count on for support.
I think that covers
I
it.
think that covers it. Okay. What do you feel is your biggest need right now?
Probably resolving the issue at hand.
Resolving the issue that whatever's causing your anxiety?
Yeah.
Have you been able to kind of either identify or get in a kind of proximity of what you think is causing your anxiety?
No.
Okay. What do you most hope to gain from coming to specific counseling with this issue?
Some peace.
Peace.
Mm-hmm.
I like that. Seems you're very, very clear on what you're trying to achieve, which is also a strength. If you were to pick 3 goals to work on right now, and it could be related to your anxiety, it could be related to just something that you want in life, something that you want to achieve in school, in your employment. If you could just identify 3 very important goals to you, what would those goals be?
Doing well in school. Being more patient. And probably being more mindful of my own needs. Like health-wise.
So I'm going to make sure that I wrote this down correctly, because I think that those are very important goals, and I think you did a good job identifying those. So you have the 3 goals that you want to work on is doing well in school, being more patient, and being more mindful of your own needs.
Yeah.
Is there anything else that you would like to make us aware that you just will want included in this assessment, or just any personal statement in regards to this? No? Well, I just want to tell you I appreciate the opportunity to talk to you. I appreciate your honesty and your transparency. And I'm hoping that the information that we got today will help us come up with a good plan to help resolve some of these issues for you.
Thank you.
Thank you.